everyone. I hope that you all are doing fine. I just thought that maybe I should give you a general overview for the infection control guidelines as well, which are followed in Australia, and it's very important for your ADC exam. Okay, so we will start. So you need to follow this guideline, which is the fourth edition, recent edition. You need to follow this one, and we can start from page 10, which is section A. So I won't be reading it word to word, but I can, highlight some important points for you that would help you in getting a general idea. And if you will read it, you will get a better understanding. Okay. So first you need to start from here, which is the section A, infection prevention and control. What is infection prevention and control? The purpose of infection prevention and control in dental practice is to prevent and minimize the transmission of disease producing agent, which are bacteria, virus and fungi, right, from one patient to another, from dental practitioner and dental staff to patient, and from patients to dental practitioner and from other staff. Like, you need to stop or prevent the transmission. This is the main agenda or main thought that we have. Then successful infection prevention and control involves understanding the basic principles of infection prevention, then creating system that allows infection prevention and control procedure to be implemented and effectively, and to make compliance with them easy, so that each and every staff could understand the infection control prevention and they could follow it, and keeping up to date regarding new or re-emerging infections, for example COVID infection. So you need to be very up to date, like what precautions you need to take and how you need to take. Okay, identifying settings and situations that require modified infection prevention and control. So you need to, these are certain points that you need to make sure to definitely follow a infection prevention and control. So in Australia, we follow these guidelines, which are given by Dental Board of Australia. Okay, and all right, so from here, droplet transmission can occur when hands become contaminated with respiratory droplet and transfer to susceptible. So there are certain type of infections that can spread, right? Like the droplet infection, aerosol infection, or the blood transmission infection. So you need to be more sure, because in dental practice settings, so there are certain type of ways where the infection can get spread. So you need to be very sure, and to make your patient safe and your staff safe, it's your duty that everyone should follow the particular infection control guidelines. In dental practice, microorganisms can be inhaled, implanted, ingested, injected, or splashed onto the skin or mucosa, and they can spread by direct contact from one person to another, or through indirect contact, like if the instruments are dirty from the previous patient, then they can act as a medium of transfer of bad bacteria or contamination. Okay, so in dental practice setting, microorganism can spread by airborne transmission, which is the most dangerous way. For example, the human influenza viruses, such as the COVID virus. So we need to take certain airborne precautions while coughing, sneezing, or talking. Transmission via large droplets, which means the splashes or splatters, it requires close contact, because if the droplets are larger in size, then they are heavy, right? So they won't travel much distance, and they do not remain suspended in the air indefinitely, but settle onto surfaces because of the influence of the gravity. Okay, for example, if we sneeze, so there are certain type of droplets that come out from our mouth, and um they can be an infectious, or they can be a source of contamination. Then droplet transmission can occur when hands become contaminated. For example, like we used to go to the shopping centers during the COVID time. So that time we used to clean the trolleys, right, before using them with the wipes, so that if there is any bad contamination on that trolleys, then we do not take them home and transfer to the susceptible mucosa such as the eyes, or when infectious respiratory droplets are expelled by coughing, sneezing, or talking, or come into contact with another person's mucosa either directly or via contaminated hands. So there is a good evidence that viral influenza and certain other respiratory infections can spread via droplets. This has implications in terms like how far they can go. They can go around 1.829 meter, which is about 6 feet. So that's that. I'm just trying to correlate everything with the COVID so that you will understand it in a better way, and these example types would stay in your mind for a longer time. So, when we used to go and there was a separation between each individual in the queue for about 2 meter or for about 1.5 meters. So that's the reason, because these droplets can travel this much distance. The distance of 1.829 meter also serves as a useful evidence of uh, evidence-based measure of how far particles from a cough or sneeze may travel forward in a straight line when expelled from the mouth. It is prudent to that supplies of clean items like including open glove boxes. So in the operatory, what you need to do is like around the chair of patient chair. Okay, so there is a dirty area. So you need to place your clean instrument or the clean glove boxes away from at least 1.829 meter. A forward separation distance of 1.829 meter will prevent these items from being contaminated with droplet expelled from the patient's mouth. And whether or not the spread of microorganism result in clinical infection depend on in the part of virulence. Like it also depends on the other factor like the droplet and the distance between the individual, but it also affect like how effective is the virulence of the particular virus or the particular organism. For example, the COVID, which it was very, very severe infection, right? And it is getting spread in one, like only in certain days we are getting so many cases. So it has very high virulence. That is the power to infect other individual. Hepatitis B virus is highly infectious, and the chance that this disease will be transferred by a contaminated penetrating injury to a non immune dental staff member is on average approximately 30%. So, if the dental staff member got injured by the infection of the hepatitis B positive blood, then there is a chance that the staff would also get this infection. There is 30% chance that he would get the infection, but the range is from 1 to 62%, and depending on the infective status of the source patient. Then in comparison, the hepatitis C virus, it has approximately 3% chance. So hepatitis B has 30% chance, hepatitis C has 3% chance, and HIV has 0.3% chance that if the patient or if the dental staff get any like needle stick injury or any injury from the instrument that was used in patient which was HIV positive or hepatitis C positive, so there are certain percent of chances that he would also get infected. For the hepatitis B, it is more, which is 30%. For hepatitis C, it's 3%, and for HIV, it's 0.3%. Patient and dental staff have varying susceptibilities to infection depending on their age, their status of health, underlying illness, and immune status. For example, if the dental staff or if a dental nurse, she is already immunocompromised, or there is some underlying condition in her body which is going on. So if she gets the infection as compared to a healthy individual, so she would be more prone to the more adverse effects. Infection prevention and control focuses on limiting on controlling factors that influence the transmission. So the spread of microorganism can be reduced by limiting surface contamination by microorganism, adhering to good personal hygiene practices, particularly hand hygiene and cough etiquette, then using PPE correctly, using disposable products where appropriate, like paper towels, following risk immunization techniques such as high volume evacuation, high volume suctions, dental dam, and pre-procedural mouth rinsing. So these three are the ways where you can reduce the infectivity of the patients towards any staff member or yourself. So the standard precautions, they are the basic process of infection prevention and control, and they should be followed for each and every individual. Do not matter if he is having any disease or not, we should follow these standard precautions for every individual, which include undertaking regular hand hygiene. So hand hygiene you need to perform at 5 moments: before touching a patient, before a procedure, after touching a patient, and after touching a patient's surrounding, which means the belongings or her bag or something, anything. Okay. Before gloving and after glove removal, and at each moment or opportunities when transmission of infection may occur. So you need to be performing regular hand hygiene, like as much as you can try to sanitize your hand, like before even touching a patient, before starting a procedure, before touching a patient, after touching a patient, after touching a patient's surrounding, and with the gloves also, before wearing a gloves and after removing a glove, just do the hand sanitization. Then using personal protective barriers, such as you need to use gloves, masks, eye protection, and gowns. These are the PPE that you need to wear for every patient. Wearing appropriate protective equipment during clinical procedures and when cleaning and reprocessing instruments. So you need to wear these PPEs not only during the clinical procedure but also during cleaning and reprocessing instruments in steady as well. Correctly handling contaminated waste. You need to handle it correctly. You need to be sure like where to dispose what thing, right? Appropriately handling sharps. It is very important how you need to dispose the needle after the LA. Then appropriately reprocessing reusable instrument which we use, such as the examination kit or the filling kits, how you need to reuse it. That first you need to do the hand cleaning, then ultrasonic cleaning, then sterilization, then batch control. Okay, then effectively undertaking environmental cleaning. It means that after one patient is gone, you need to clean the chair, you need to clean the dirty area, you need to put the barriers on top of that for the to get ready for the next patient. Following respiratory okay, so these things you won't be doing as a dentist, your dental assistant would be doing, but you need to make sure that this should be done. This is all under your responsibility. Following respiratory hygiene and cough etiquette, then using the correct aseptic non-touch technique where indicated, appropriately handling used linen and clinical gowns, and using where appropriate single-use environmental barriers such as plastic covering on surfaces and items that may become contaminated and are difficult to clean. For example, the curing light. So it is very difficult that we can sterilize it or we can clean it, so it is important to put a barrier on top of that. Okay, then these standard precautions minimize the risk of transmission of infection from one person to another and are required for the treatment of all dental patients, regardless of whether they are the patient is infected or is a carrier or any of that. Okay, standard precautions are also essential when cleaning the dental surgery, when handling items contaminated, for example, x-rays, films or sensors, dentures. You should not hold with your naked hand. Then orthodontic appliances, wax rims, prosthetic work, even anything which has the blood or saliva or any other body fluid, such as excluding the sweat, you need to wear the PPE. In certain circumstances, patients have a specific highly infectious condition that necessitates the use of. So these precautions you should be following for every patient, but some patients have additional disease which is highly infectious. So you need to follow the transmission based precautions for them. For example, for highly infectious diseases, COVID. Okay, so transmission based precautions are applied when patients are susceptible for or confirmed to be infected with agents that are transmitted by contact, droplet, or airborne route. Okay, even like talking to those patients would can also infect you. So you need to take certain other additional precautions for them. The range of measures used in transmission-based precautions depends on the route of transmission, and the application of these precautions in particularly important in containing multi-resistant organisms in hospital environment, and if there is any in the management of outbreaks of norovirus gastroenteritis. So you should be more prepared for these patients. Details of these precautions are required for specific infectious disease are given in 2019 version. In brief, transmission-based precautions are used when there is a risk of direct or indirect contact transmission. For example, viral influenza, MRSA, Clostridium difficile, or highly contagious skin or skin infection or infestations. Okay. Droplet precautions are intended to prevent transmission of infectious agent through respiratory or mucous membrane contact with respiratory secretions. These microorganisms do not travel over a longer distance due to their size. So what additional precaution you are taking? You are taking airborne precaution, which means that you need to wear the P2N95 surgical respirator mask. Respirators, okay, are designed to reduce the likelihood of transmission of microorganism that remains infectious over time and distance, which remains suspended in the air for longer period of time due to their smaller size. Then these agents may be inhaled, susceptible. Okay, so infectious agent for which airborne precautions are indicated includes measles, chickenpox, mycobacterium tuberculosis, and novel respiratory pathogens like H5N1 influenza, avian influenza, and coronaviruses. So you need to follow these airborne precautions, which is the P2N95 surgical respirator. And there is strong evidence to support and recommend the use of negatively pressurized room for patients who are at risk of transmitting. So there are two precautions that we have read so far. First is the mask, surgical respirator, and second is the room should be negatively pressurized room. This means that the patient care under airborne precautions is often not possible in a private small office practice setting. So, in negatively pressurized room means that the air conditioning plant and approved by an appropriately trained engineer. So, in those rooms the pressure the air conditioning pressure is negative, so they are special type of room that are made so that the transfer of the disease would not happen through the airborne uh, So this is the second point that you need to consider for those patients. And for effective airborne precautions, a P2N95 respirator is required, which forms an airtight seal with the face. In order to be effective, these respirators must be fit tested at regular intervals and then fit checked at the time of each use. Healthcare workers with facial hair must be aware that this prevents the formation of an airtight seal between the respirator and the facial skin. At present, there is a lack of evidence from clinical trials regarding the additional benefits over conventional. So a surgical mask that is sealed tightly to the face, it has shown to block the entry of 95% of total influenza viruses, while tightly sealed N95 respirator has shown 99% of blocked entry. If you are wearing loosely fitted surgical mask, then it would only prevent 56% of the bacteria or the microorganisms, and the poorly fitted respirator would prevent 66%. So they mean that you should use the N95 respirator, but it should also be its fit should be proper. Otherwise, if it is loosely placed, then it would not serve you better. The majority of procedures undertaken in dentistry does generate aerosols. Okay, some items of equipment are more likely to generate intense aerosols, such as ultrasonic scalers and high-speed air turbine, like high-speed hand pieces. Therefore, it is important to recognize that patients with viral influenza, active tuberculosis, measles, or chickenpox pose a considerable risk for dental staff and to others patient if they undergo dental treatment. Okay, so these are aerosol based transmission based infections, so you should be extra cautious with these patients. Patients with viral influenza should not have elective dental treatment. So, if the patient has COVID positive, so he should not have active dental treatment if they are in a stage of infectious stage, which is 2 weeks for a patient aged 13 years and above, and 3 weeks after symptoms develop for patients aged 12 or less. If patients with viral influenza require urgent care, then you need to follow the transmission based precautions. And what are these precautions? That are, the patient is seen as the last patient of the day, ensuring that staff which would provide the treatment are completely immunized against that circulating influenza strain, and use a pre-procedural mouth rinse. Use a dental dam for respiratory procedure, minimize the use of aerosol generating techniques, and applying two complete cycle of cleaning. If the patient is seen during the day, then allow 30 minutes of fallow time before the room is used for further patient. So these are some of the additional things that you need to follow for the patient who has the risk of transmission based infection. Then there are some legislative frameworks, that the policies and guidelines that you need to cover. It is not very important. And duty of care of dental practitioner is that you should be responsible. You must ensure that the premises is clean, and that the everyone is the infection control is developed, and implement work practices and document their infection prevention and control protocols. Ensure that all staff have read the infection control guidelines, and provide their dental staff with access to key resources such as the ADA guidelines and the current editions. Have in place a system of reporting. If there is any incident, there should be a system of reporting, monitoring, and rectifying breaches of the infection control. Ensure an immunization program for dental staff. Maintain an immunization status. Maintain a record of workplace incidents. Maintain an allergy record for each member of the dental staff. Implement specific training and education on the correct use of APP. So it is all your responsibility that you need to make sure that in your practice, everyone should follow these infection control guidelines, and have the certain procedures that they need to follow. Everyone should be immunized, mainly through the deadly blood-borne viruses diseases, and the implement system for environmental cleaning and reusable. So everything you need to make sure that everyone is following this. All right, so if the infection, all right, so if the patient who has positive hepatitis B, C, or HIV, you should treat him like a normal patient. You should follow the standard precautions for him. Okay. There should be nothing different as for the normal patient, or if the patient is positive for blood-borne viruses. If the dental practitioner get infected from any patient, then he need to inform that and get himself or herself tested to evaluate what is the risk in her body, to find out like what's going on, and he should not practice until the viral load goes down, or his medical practitioner gives him the green light, like you can practice now. So he should not come back to the practice until he's not no longer infectious. All right, so these are some of the most important points from these pages, and I will try to cover like as much as I can. So we have covered those pages today, and next time we will cover this section B. All right, thank you guys for watching my video, and I hope that you all are enjoying it. And all right, hope to see you guys again in the next video.